It used to be an urban problem. It is now a suburban and rural problem as well, and maybe even more so in the suburbs and rural regions of Connecticut than in its urban areas. There's been a flip-flop transition in who uses these drugs. The suburbanites who we have recently studied in Fairfield and New Haven counties, recruiting almost 500 of them, were younger than their urban counterparts by at least 10 years, in their early 30s. They'd been using drugs for 10 or 11 years. Many of them may have started their path to addiction with pharmaceutical opiates, but they have transitioned to injecting heroin because, as controls have been put in place to restrict access to these pharmaceutical opiates, the unintended consequences have been that heroin is now attractive, both because it's cheaper and because it's easier to get. A lot of these people come into the city centers to buy their heroin but go home and inject. And as a result of that, they really are ignorant, remain ignorant of the basic kind of prevention knowledge, prevention information, prevention materials that their urban counterparts have gotten. That's been very... Overdose is a big problem, and it's overdose that's bringing this issue into focus through journalistic reports of people dying of heroin in the suburbs and in the rural parts of the state. Opioid overdoses in general are reversible with a drug called naloxone, Narcan, which is an opioid antagonist that basically knocks the heroin or the pharmaceutical opiate off the site in the brain that is diminishing respiration, slowing breathing, causing people to die. So these drug treatment programs are now, as part of orientation when people come in, providing them with the training to be aware of this problem when they leave treatment, and even offering them naloxone as part of overdose intervention and prevention. Overdose deaths now exceed, automobile accidents as unintentional causes of death. You need trained people, you need programs that expand their reach from the urban centers where they're focused now, the Hartford Dispensary, App Foundation in New Haven, Recovery Network of programs in Bridgeport. They're great programs, but they're centered now in the wrong part of the state. They need to have satellite clinics in areas where they can be more effective. And